Hello everybody. Welcome to No1doctor channel. Today we will talk about one of the famous doctors. Guillaume Dupuytren, 1777 to 1835. Dupuytren's contracture. Dupuytren's contracture is a common condition, usually of the elderly, and much more frequent in men than in women. There is fibrous contracture of the palmar aponeurosis, which produces a flexion deformity of the finger at the metacarpophalangeal and proximal interphalangeal joints, usually starting at the ring finger, then affecting the little finger and sometimes the middle finger. As the palmar aponeurosis only extends to the middle phalanx, the distal interphalangeal joint is never affected. Indeed, in advanced cases, the terminal phalanx may be hyperextended into the palm of the hand. Occasionally, the plantar aponeurosis on the sole of the foot may be affected, although, when present, it may remain undetected by the patient. In spite of its frequency, its etiology remains a mystery. How did such a common entity, which must date back to earliest times, and which is so easy to identify, be named after a surgeon of the early 19th century? The fact is that it was regarded as being due to contractures of the flexor tendons of the fingers. Dupuytren carefully dissected the upper limb of a subject with this condition at autopsy. Removal of the skin had no effect on the contracture. Removal of the underlying thickened aponeurosis enabled him to straighten out the fingers completely. The tendons were normal. Guillaume Dupuytren was born in 1777 at Puy-Beaufier, a small town in central France. His father was a lawyer with a small practice and little money. Dupuytren studied medicine in Paris, although he was almost penniless. There is a story, probably apocryphal, that he used the fat from cadavers in the dissecting room to make oil for the lamp he studied by. In 1802 he qualified and, at the age of 25, became a surgical intern at that repository of pathology, the Hotel Dieu. The following year he published a small book, Propositions on Several Points in Anatomy. Within 11 years, he was appointed surgeon-in-chief, with unlimited opportunities for the two things he loved, surgery and teaching. For the next 30 years, Dupuytren labored at his duties. His first rounds were at 6 in the morning. His evening rounds were at 7, to visit post-operative patients and any others whose condition was serious. He was a brilliant bedside teacher, whose rounds and clinical lectures attracted crowds of students and postgraduates. As an operator, in those pre-anesthetic days, he showed perfect self-control. He pioneered amputation of the mandible, amputation of the uterine cervix for cancer, irrigation of the subclavian artery and colostomy, bringing out a loop of colon through a lumbar incision. Dupuytren was cold, overbearing and parsimonious, no doubt the legacy of his penniless youth. He was called by his contemporaries the first of surgeons and the least of men and the brigand of the Hotel Dieu. In November 1833, he suffered a stroke while engaged on a ward round at the Hotel Dieu and was obliged to give up work. He died on February 8, 1835 at the age of 57, having, as one admirer wrote, lifted himself from the most humble to the highest rank, and added another name to the glories of France. Thanks for watching. Hope to see you again in more next videos. With my best wishes. Dr. 8 Fahmed.